இப்போ ரீசெண்ட் டேஸா ஐபிடிஆர்ஜி கோடிங்க்கு நிறைய ஓப்பனிங்ஸ் போய்க்கிட்டு இருக்கு. 70K 1 lakh அப்படின்னு அட்ராக்டிவான ஜாயினிங் போனஸோட ரெக்ரூட் பண்ணிட்டு இருக்காங்க. ஸோ மெனி பீப்புள் லேர்ன் inpatient coding, but during interviews they struggle to answer simple DRG questions. So in this video I'm going to share some important IPDRG questions for you. So if you are preparing for a medical coding interview, especially for IPDRG projects, this video will help you. So watch the video till the end. ஸோ வாங்க இப்போ வீடியோக்குள்ளே போகலாம். What is DRG in inpatient coding? DRG stands for Diagnosis Related Group. It is a classification system used to group inpatient hospital cases based on similar clinical conditions and expected resource utilization. DRG assignment is based on clinical diagnosis, secondary diagnosis, procedures performed, and then patient age and gender, finally discharge status. So hospitals are reimbursed based on the DRG assigned to the patient encounter. ஸோ இதில் ரொம்ப இம்பார்ட்டண்ட்டான பாயிண்ட் என்ன அப்படின்னா, அவுட் பேஷண்ட் கோடிங்கில் ஒவ்வொரு ப்ரொசீஜருக்கும் செப்பரேட்டாக பேமெண்ட் வந்துடும். பட் இன் இன்பேஷண்ட் we are having a particular system called DRG, that is diagnosis related grouping. It is a payment system for that inpatient coding. So in outpatient coding, the procedure to procedure payment, each CPT will carry the cost. But in inpatient coding, the payment will be calculated not based on ICD and not based on CPT. So how the cost is going to be calculated? It will be calculated based on the DRG code assignment. Okay. It will cover all the services performed during an inpatient hospital stay. Okay. What factors can change your DRG? So many factors can influence the DRG grouping. So we'll see it now. Presence of CC or MCC, major surgical procedures, patient demographics, discharge disposition, complications during hospitalization. So these are all the factors that can influence DRG grouping. For example, if a patient has a MCC condition like acute respiratory failure, means the DRG weight increases, which results in higher reimbursement. So in this way, MCC influence DRG grouping. Next, what is the difference between CC and MCC? CC stands for complication or comorbidity. MCC stands for major complication or comorbidity. Both represents conditions that increase the complexity of patient care. However, MCC conditions are more severe and have a greater impact on hospital resource utilization and DRG reimbursement. So in this way you have to answer to this question. Okay. Next, what is the principal diagnosis in inpatient coding? So the principal diagnosis is defined as the condition established after study to be chiefly responsible for the patient's admission to the hospital. Correct identification of principal diagnosis is important because it directly affects the DRG assignment. So the principal diagnosis identification and sequencing is very important in DRG coding system. Okay. Next, what is POA indicator? POA stands for present on admission. So it indicates whether a condition was already present when the patient was admitted to the hospital. So common POA indicators include yes, no, unknown, and undetermined. So Y represents yes, N represents no, U represents unknown, and then W indicates clinically undetermined. So POA reporting helps to identify the hospital acquired conditions. Okay. Next, when should a coder send a physician query? This is very important in Ipdrg coding system. A query should be sent to A query should be sent when documentation is unclear, incomplete, or conflicting. Okay. So, for example, if you have any missing diagnosis specificity means that time we can query. Next, conflicting documentation in the chart or clinical indicators present but diagnosis not documented means that time we can query. Next, why is sequencing important in inpatient coding? So, sequencing determines the order in which diagnosis and procedures are coded. The principal diagnosis must always be sequenced first, followed by secondary diagnosis. Incorrect sequencing can lead to wrong DRG assignment and incorrect reimbursement. So the sequencing is very important. So finally, one important question: what is the difference between outpatient and inpatient coding system? So the outpatient coding is based on procedure to procedure payment, and each CPT will carry the cost. In inpatient coding, the payment will be calculated based on the DRG. It will cover all the services provided during an inpatient hospital stay. Okay.